Dr. Newsome. He's a native of Monroe. He earned his Bachelor of Science from Louisiana State University here in Baton Rouge. He received his medical degree from Howard University College of Medicine in Washington, D.C. He completed his internal medicine internship and residency from Thomas Jefferson University Hospital in Philadelphia, Pennsylvania. Dr. Newsome completed his cardiology fellowship at Drexel University and Hahnemann University Hospital in Philadelphia, Pennsylvania. Dr. Newsome is a board certified in cardiovascular diseases, nuclear cardiology, and internal medicine. He is a member of many professional organizations, including the American Society of Endocardiography, American Society of Nuclear Cardiology, American College of Cardiology, Association of Black Cardiologists, National Medical Association, and American Medical Association. He has offices in Baton Rouge, Mid-City, Rouge, Denham Springs, and Zachary. And for more information on Dr. Newsome, I think they gave you a nice card, but you can also visit www.brcardiology.com. And please join me in giving a nice round of applause and welcome for Dr. Newsome.
Good morning, everyone. I've been tasked to speak to you guys about heart palpitations, and so hopefully this lecture will be informative to you and give you some guidelines on what to do or what you would feel if you would have some type of palpitations or heart arrhythmias. We'll have a question and answering portion at the end of the lecture, but this is informal. If you have a pressing need, just go ahead and we'll address the question right there on the spot. So, heart palpitations. What is a heart palpitation? You've heard this word before, or maybe you haven't. But today I'm trying to give you a little more information on what we define as a heart palpitation. People will come to the office and they say, I have this thumping in my chest, I have a fluttering in my chest, my heart is flip-flopping. Anything that you can describe that's somewhat out of the norm. You feel the pounding, you may say you feel a skip beat. We classify all of these symptoms into the realm of a heart palpitation. Now, what actually causes a heart palpitation is one of the following here. We have what we call a FACC, that's an abbreviation, medical terminology means a premature atrial contraction. And I kind of put this little diagram here because this is a picture of the heart. The heart has 4 chambers. This is kind of the heart sliced in half. Has 2 chambers in the top and then 2 chambers in the bottom. And you see this green. That green is kind of the electrical conduction. If you would think about it in a electrical fashion, it would be like the copper wiring in the heart. It sends the electrical conduction to make the muscle squeeze. Well, sometimes these copper wiring that's kind of intrinsic to the heart can give little extra beats. And so when I say a premature atrial, that means it came from the top 2 chambers. The atria had this extra beat and the heart kind of gave a skip beat or a sensation that you felt something abnormal in your chest. Now the other one here is what we call a PVC. That's a premature ventricular contraction. And that usually arises in the bottom chambers. The top chambers are atria, the bottom chamber are ventricles. And so this is majority of what people have when they say they have heart palpitations, either PACs or PVCs. And there are some other types of arrhythmias. Atrial fibrillation is a very, very common heart arrhythmia. It's probably the most common heart arrhythmia. Majority of people have atrial fibrillation when they start getting into their elder years. So much so that drug companies market directly to people. I'm sure no one has not seen a commercial about a blood thinner. And sometimes, most of the time, those blood thinners are being used in people with atrial fibrillation. Atrial flutter is another type of heart arrhythmia that you may feel some palpitations. But some of these other things, types of arrhythmias, you'll also feel the fluttering in the chest. So some things to take consideration. Normal heart, what we call normal heart rate, is between the range of 60 and 100 beats per minute. So anything over that we call is fast, and we call it tachycardia. And anything slower than that we'll call bradycardia. And sometimes you may have heard a term, an extrasystole. That means that you just had an extra beat. Maybe it be a PAC or a PVC. So these are just some things to kind of keep in mind. And so here the diagram kind of shows you again how the electrical activity goes through the heart. This is what a normal heartbeat looks like on the ECG or the tracings that we do of the heart. I'll have some other examples later of what an abnormal looks like. But normally the impulse for the heart to contract starts here in the sinus node. And that electrical activity goes through these little currents down to this part. This is the AV node. And then it goes out to each ventricle through these little conduction pathways. And that's when everything is functioning correctly. This is what we see on an EKG. So we got a lot of things that can cause heart-related palpitations, but here are some things that cause non-heart related palpitations or flooding in the chest, so to speak. So sometimes stress can do it, just the stress of life, stress of work, job, family stress. It kind of increases the amount of endorphins in your system, the stimulants, and it may activate the heart to have these irregular heart rhythms. Anxiety. Now, anxiety is twofold. Anxiety can do the same thing where it activates these endorphins in the body to make the heart act irregular. But sometimes we'll put a monitor on people who have anxiety and they're actually feeling things that are not there. They'll tell me they feel their heart racing, and we put a monitor on them and everything is fine. So it's kind of like their heart, their mind is taking over and making themselves feel like something is wrong. But actually, in actuality, everything is fine. That's kind of the crux of what a panic attack is. You feel like everything is about to just cave in on you. You can't breathe, your heart's racing, you do all these things. But then when you actually would show up in the emergency room, they check your oxygen level, it's normal, your heart rate's normal, everything is fine, but you feel like you're about to pass out. Other things, dehydration. Dehydration makes your heart go fast just because it's trying to make up from low volume in the system. And so sometimes that can trigger these palpitations. Electrolyte abnormalities. You had a question? No. Electrolyte abnormalities, low potassium, low sodium. If you're out all day in the sun and the heat, mowing yards, you lose a lot of electrolytes. You lose a lot of sodium, a lot of potassium in your sweat, and sometimes that can be the trigger for you to have some irregular heartbeats and rhythms. All of these are just kind of stimulants. Caffeine, chocolate, alcohol, all these can affect your heart. Nicotine, smoking, that can affect your heart as well. So, again, we have more reasons for these irregular heartbeats. If people are sick, they have a fever, some type of infection, that can be a cause. Low blood counts, anemia. Your thyroid gland, this is something that we check a lot. The thyroid sits here in the neck, and it secretes hormone. The hormone the thyroid secretes is a stimulant. It stimulates your body to kind of regulate normal body function. But if that thyroid is overactive, it will make you have things like diarrhea, it'll make you have profuse sweating, it will make you lose weight, and it will give you heart palpitations. This little diagram here, this is what I was showing, mentioned earlier. These little big kind of electrical tracings, those are what we call PVCs. Those are the ventricular contractions. And the rest of them are actually normal heartbeats. That's what the normal electrical conduction looks like. And then if you get these little extra beats, this is what a lot of people say, it feels like their heart's pounding. All of a sudden it's just pounding in their chest. So they feel these little extra beats. And just to let you know, if they occur in isolation like that, one beat here, one beat there, they're usually very benign, meaning they're not life-threatening. It's something usually that the doctor will just kind of monitor. But if they're very concerning to you or they're causing you to change your lifestyle, things that you do, they may start a medication. But we try not to start a medication for that. So back to some non-heart related causes, pregnancy. pregnancy, menopause, we know that there's a hormonal relationship to palpitations. More time than not, I think it may be 3 to 4 times as many women than men have palpitations. And it's not uncommon for me to see a pregnant woman come into the office and say their heart's racing, they get lightheaded and dizzy, and we know this is hormonally related. Some other things, different types of drugs, dietary supplements. Usually these dietary supplements are things that possess stimulants, caffeine, things like this. Some people take pills for weight loss. All these things can cause palpitations. So,
You got the heartburn.
heartburn. So, I glossed over it, but some people can have significant heartburn or indigestion, and that kind of stimulates a response where it's kind of, it can be a stimulant. Now, the thing is that the heartburn is not connected to the heart. Heartburn is connected to the GI tract, the stomach and the esophagus, but sometimes that burning sensation sends like a panic kind of signal in the body, and it makes a stimulant to the heart that something's wrong, and it kind of, yes, sir. Do you have a lot of palpitations?
What is that?
The fluttering in your chest?
I got AFib.
You got AFib, yes, sir. So those things sometimes can trigger different types of arrhythmias. It's not common, but we have seen a relationship with it.
Thanks.
No problem. Heart conditions that lead to palpitations or different type of irregular heart rhythm. Obviously, if you've had a prior heart attack or coronary artery disease, coronary artery disease is what you have prior to having a heart attack. You have a blockage. It's not severe or maybe approaching severe, but if it becomes 100% blocked, that's a heart attack. And so when you have damage to the heart muscle, you're very prone to having irregularities in the rhythm and therefore irregular heartbeats. Yes, sir.
When you say blockage, is that related to blood clot, or that's two different things?
So a lot of people think a blockage is a blood clot. It's somewhat, but that's not the true answer. A blockage in the arteries of the heart is actually cholesterol and plaque kind of building up within the walls and makes the blood vessel narrow. When we say a blood clot, it's actually that blood cells have actually clotted, usually start in the legs or somewhere in that place and can travel to the lung. Usually you don't have a blood clot in the arteries of the heart. Usually it's a buildup of cholesterol and plaque, and over the years it kind of gets narrower, more narrow and more narrow, and that's what leads to a heart attack. No problem. So heart failure. Heart failure, I tend to let people know a majority of heart failure is what you have after you have a big heart attack. The heart muscle is damaged. It's not squeezing well. And so with the weakness of the heart muscle not squeezing well, then you have heart failure. You have a buildup of fluid, you have shortness of breath, and that leads to having these irregular heart rhythms.
Well, can the heart repair itself after heart failure?
Not usually. Not usually. Now, I will tell you with medications, we tend to prevent heart failure from getting worse. In some scenarios, the heart muscle does improve, but we can't say, yes, it's always going to improve. Some scenarios, yes, it improves with medication, diet, exercise, if you start doing what you're eating better, exercise, and things of that nature. So I guess the straightforward answer is sometimes.
Sometimes. Yeah.
Right.
I'm there sometimes. You had a slide on there when you showed the heart, cutaway view of the heart. I wanted to ask you,
This one?
I think back a little further, right there. I was told either the left side or the right side, the fluid backs up into the left side or the right side that causes congestion of heart failure. I was on to the doctor before, he checked my lower legs for fluid. Then he always asked me, are you short of breath? But at the time I answered no, but over the years I started noticing I was short of breath.
Yes, sir.
So the fluid started bagging up into the heart, and that causes what side of the heart to fail, the right or the left?
It starts probably with the left side, and you start getting failure to the left side. The blood kind of backs up into the lungs because the blood comes from the lungs into this side of the heart and gets pumped out to the body. So then it may start backing up in the lungs. You'd have shortness of breath. And then as it's backing up into the lungs, it may start backing up into the legs because that's where the blood's returning from.
Would that be the PAC or the PBC?
No, that's totally different.
That's different?
Yeah, so now we're talking about irregular heart rhythms, palpitations, but now you're asking about congestive heart failure. So what I was saying is congestive heart failure can tend to lead to you having palpitations or PVCs. Now there's a higher incidence of the people who have congestive heart failure to have these extra beats, these PVCs, and we see that a lot. But it's the PVCs don't lead to congestive heart failure, generally speaking.
All right, appreciate that.
No problem. So we kind of touched on this. The skip beats, some of the skip beats, like you say, you're feeling can be those PACs and maybe atrial fibrillation or other types of irregular heartbeats. So I didn't mention this before, but some of the other things that can lead to you having irregular heartbeats are irregular beats of the heart is abnormal heart valve. So if you have mitral valve prolapse, there was a situation where you tend to have irregular heart rhythms at some time. So this is something that your doctor would check for. Yes, sir.
When we go back to the pacemaker,
What pacemaker? We ain't talked about pacemaker. You have a question about pacemaker?
yes, I have one.
Okay.
And to what degree and for how long will this pacemaker be relevant to my heart?
I would not be able to answer that because I don't know your heart condition. But generally speaking, once people get pacemakers, they usually keep them for the rest of their life.
Yes.
Generally speaking, yes, sir. So we were talking about some different type of heart arrhythmias. So one thing I just wanted to note that most heart arrhythmias or the palpitations are usually non-life-threatening. Once we identify what they are, usually either we're able to do nothing or remove the stimulus, whether it be overactive thyroid or drinking excessive amounts of caffeine or things of that nature. Usually if you remove the stimulus, people feel better, or if they need be, they can be started on a medication to kind of suppress it. In some situations, we have life-threatening palpitations or irregular heart rhythm, and those usually arise from the bottom chambers of the heart. And so you may have never heard of terms of ventricular tachycardia or VT or unsustained VT or ventricular fibrillation. Those are very life-threatening heart arrhythmias, and they arise from the bottom chambers of the heart. And what they do, they create this discordance where the heart is not actively pumping. So if you have one of those arrhythmias, the bottom chambers are just kind of sitting there quivering, and therefore no blood flow, and therefore people pass out and die, potentially from these irregular heart rhythms. If you ever heard of a young athlete just playing basketball or football and just dying on the field, they usually have one of these types of arrhythmias. They were doing fine, having this normal heartbeat, and then their heart kind of degenerates into something like that, and therefore no blood flow is flowing. And that's why they have those AEDs everywhere to kind of potentially shock their heart back to a normal rhythm. Yes, sir.
Going forward with that athlete, speaking of that, how could that have been spotted or caught before we get to that point where?
Sometimes there's not much you can do to know it. Sometimes it's just a genetic predisposition. Maybe their family members, a father, a grandfather, somebody died at a young age from an unexplained reason, and therefore they need genetic testing to kind of see if they're predisposed to it. In some individuals, they may have some structural heart abnormalities, meaning that their heart is enlarged, it's big, it's dilated, or the muscle chamber is very thickened. So sometimes that may give an indication that they're at risk for that. But some scenarios that you would have to do some genetic blood testing, sent off to some rare labs to kind of see if something runs in the family.
You know, because 30 years ago when I played sport, 35, 40 years ago, you know, in high school, they didn't do the check.
Right.
I had a teammate, he passed away because of that.
Right. Right. And it's not routine. They don't actually, right now, when high school players get physicals and and get evaluated, they don't go through a significant heart check. They may get an EKG, but an EKG won't pick this up.
Won't pick that up.
Nope, because sometimes this only happens under stress when they're playing sports or things of that nature. Or you may be able to see it with an ultrasound of the heart, an echocardiogram, if they had a structurally abnormal heart. But that's not the routine, what they do from a general physical for a high school athlete. So some things that we can kind of tell you guys to kind of give you a little background to, if you know how to take your pulse, kind of see if your heart's racing. You can count it out, see how fast it's going. You can sometimes, if with more skill, you can actually feel that the heart's skipping a beat or you got extra beats. It's what we call, is the heart rate irregular? Is it going fast? Is it going slow? Is it regular? Is it irregular? So these are the things that you can kind of, that we as physicians do, but sometimes patients are able to realize this as well. And a lot of days now, a lot of people have these activity trackers, the Fitbits, the things of that nature. Sometimes they can give you an idea if your heart rate is going fast, if it has a heart rate monitor on it. So that's something to kind of realize. I've had patients come in and say, hey, look at my trend. My heart rate's always doing this. And so it gives us an idea of what we need to look for. We've kind of discussed this about looking at your heart rate. And this is what I was telling you. You kind of see if it's going fast or slow, regular or irregular. And you kind of want to write down what's going on when you feel it. Like, did you just eat a meal? Did you just wake up from sleep? Or did the palpitations wake you up out of your sleep? And with this more information, this would be helpful to the physicians on trying to figure out how we're going to go about treating you.
If it wake you up during your sleep, it's nothing to be alarmed about? Or
Can't say. I can't say. Waking up out of sleep is not an indication if it was life-threatening or severe or not. But again, it would be probably something to get checked on if it wake you out of sleep. Now, one thing I tell a lot of my patients is, most people say they don't feel it. The most time of the day they feel it is at night when they're laying down in bed. Now, one thing I will tell you guys is that's the time that you're most still and most quiet. All the TVs are out, lights are out, and you're just kind of laying there. So that's the time when people notice it most of the day. Most of the time, if you're walking around, you're doing something, you're out working, you're busy, you're doing things, it could be happening all day. It's such that the thing is, you're moving, you're active, and therefore you don't feel it or you don't discover it. Usually when you're quiet, you're still, there's no noise, and that's the only time most people can feel them or hear them, and that's usually right before bedtime. So we discussed this, some of the risk factors and things to know. If you have heart disease, if you have diabetes, if you have thyroid problems, you're obviously at higher risk. And if you start feeling these palpitations, you want to be more alert to probably call your doctor and get in for an evaluation. If you've had a heart attack in the past, if you have things like that, it pushes those heart arrhythmias more to the side of being more concerning, more life-threatening. 25-year-old female who's saying she's having palpitations is usually not going to be very concerning. It may be that she feels them and they're disturbing to them, but once we do an evaluation, we usually find that they're not life-threatening. And if we change some things, caffeine intake or less stress, then maybe we can minimize the amount of palpitations that person is having. So one of the things we do for tests, we have people wear these things called a Holter monitor. Has these little sticky electrodes on them, and it records your heart rhythm for a whole 24 hours. And so therefore, we get a printout of everything that's going on. And during that printout, we actually have there's a button that you can press that if you feel something, it actually highlights that, and you can write what you felt. At 5:35, I felt lightheaded, sweaty, and pounding in my chest. When we get that printout, we can go to 5:35 and see exactly what you were feeling. And this is what we use when I remember I told you earlier, some people say they have anxiety and they feel all their heart racing. Well, if they tell me that their heart was racing and they write it down and I look at it and everything is fine, then I can say, hey, it's your mind's playing tricks on you, so to speak. And so that actually brings their stress level down. If I can see and tell them that, hey, everything is fine. We didn't see anything at all. It actually brings their stress level, anxiety down. Part of the problem for people with anxiety is the not knowing. They think they feel something, they don't know, it gets worse. And this is kind of some of the summary we get. The time of day, and you would have to log what you were doing and what type of symptoms you were having, and we'll be able to look at the strip and see if everything was normal or not. And so here's a printout of someone. This is a normal EKG, and you can see at this time they had this big pause, and they documented that, and that's what we were dealing with. Now the underlying rhythm in this, you can see is irregular. And what we call irregular, if you see here, right on beat, it's about the same space between each beat. The heart makes a beat, a contraction. Well, you can see here, it's a different amount of space between here and there. It's smaller, it gets longer, smaller, very long. So this person's in atrial fibrillation here. In the atrial fibrillation, you can start feeling the irregularity sometimes in your heartbeat. Sometimes it goes slow, sometimes it goes fast, but that's what people feel. So some other tests you may end up having are chest x-ray, obviously the EKG. A loop recorder is something that we actually implant into the chest, and it actually can stay there for a couple of years. And during that time period, we're able to record what's going on with your heart. This is for people who have things infrequent. Maybe once a year, they may pass out from having palpitations. And when they come and get a checkup from the doctor, all we see is everything is fine. So we can't actually diagnose them unless we see what's going on when they're having the symptoms. So sometimes we're able to put this loop recorder in there, and that consistently records their heart rhythm for a few years. Ultrasound or echocardiogram, this is what this person's getting here. We kind of look at the structure of the heart, the function, trying to see what's going on. Ultimately, if you're having life-threatening issues, I mean, you might need a heart catheterization. That's what a cardiac cath is, to kind of diagnose if you have severe blockages or something of that nature causing you to have the palpitations. And lastly here, one of the other treatments is an ablation. I don't know if people are very familiar with an ablation, but an ablation is a very complex procedure where they have a lot of catheters inside the heart, and they can find where the irregular heart rhythm is coming from and kind of burn out that little site. Remember that first picture I had up with, I told you the electrical conduction is like copper wiring? Well, they basically go in and just cut an area in that wire so you can't have that conduction going through the heart. This is something else that may be potential if you have a intrinsic heart problem. If the heart's enlarged, you may end up getting a cardiac CT or MRI of the heart to kind of look at the tissue of the heart and the function. This is for people who have more advanced heart disease. This is the slide I was telling you about, the recorder, the loop recorder. It's a little small device. It's very small, 1 3/4 inches long, but they make a small incision right here over the chest wall, and we just slide it right under the skin. And it sits here. The heart's there and monitors the heart. That little device has a battery life of up to 3 years. So if you have something that doesn't happen frequently, but you're very concerned about it, or your doctor's concerned about it, you may be advised to have this little device implanted. Oh, and this is a slide I just wanted to give you guys a little background. This is what an ablation procedure tends to look like. You have all these catheters and wires coming into the heart. They put these things here to kind of find where the arrhythmia is coming from. All of these are kind of monitors to see where it's coming from. And then this thing here, this is the ablation catheters. So I said burn, but actually the proper term is kind of freeze it, because these coils don't heat up, they just get very cold. And being that it's so cold, it creates a scar around this area. It kind of freezes those cells, and then freezing it so fast, it kind of kills that little area. And so therefore, that's the nature of it. It can create an area where it kind of disconnects the copper wiring from the rest of it. And so therefore, that little palpitation or those irregular heart rhythms don't proceed throughout the whole heart chamber. And so that's kind of the most complex procedures one of the heart doctors can do, and only electrophysiologists do these procedures. But that's potentially one of the cures for if you're having irregular heart rhythms or bad palpitations. Another thing, a pacemaker or a defibrillator. So if you're having one of heart rhythms where your heart is going too slow, or you have some type of heart block, then a pacemaker may fix that. An ICD or a defibrillator is pretty much the same thing, except defibrillator has the ability to shock your heart. So we talked about the life-threatening heart rhythms, the young athletes dying while they were participating in sports. This defibrillator has a shock coil. It goes into the heart, sits in the chest wall, and the wires go into this vein and go into the heart. And if the heart starts doing an irregular heart rhythm while you have one of those, that defibrillator is able to shock the heart and get it back into a normal rhythm. What we like to call is your own personal life insurance policy. So if you're a candidate for those, if we see you have some structural heart disease or some problems, then you may be a candidate for that defibrillator. So those are the extreme things. Again, we kind of spoke of the simple things that we can do. Stop drinking so much coffee, caffeine. Alcohol can sometimes be a trigger. We have people who have binge alcohol drinking over the weekend, and Monday morning the heart rate is going crazy. So the alcohol can actually affect your heart. You want to watch your diet. Watch your things you're eating, your sugars, the starches. All these things can actually trigger your heart going into irregular heart rhythm. So those are the causes, the treatments of palpitations. We've kind of answered some questions as we proceeded through the lecture. You guys have any other questions at this time? Yes, sir.
Okay, a regular physical, and when I came in to you at Blackman, and we did the treadmill and we did all that stuff, that's called a high-tech physical. What was that called? You know, what you did the treadmill and you hooked me up and you.
So for that was just generally depends on what your symptoms are. If you're having chest discomfort, shortness of breath, we usually put you on a treadmill. It's more of a low-risk kind of screening mechanism to kind of see if anything is abnormal. And from there, if the treadmill is abnormal, we may choose to do some further testing, either a nuclear stress test or a heart catheterization. So those are some of the things that we use for low-risk kind of patients that we like, yeah, you may have something wrong, but we're not sure.
But if I wanted to have that done again, whether my insurance took it or not, is more important than
Right,
money.
right.
So if I want to have that done again by you, I would just have to call and tell you I'm going to have it done?
Yes, sir.
Okay.
Yes, sir. You just come to the office and we'll get you set up for that. And that's the thing. A treadmill study is actually kind of good for you to kind of see where you're at baseline. Sometimes if people tell me, hey, I want to start a workout program, an exercise program, but I hadn't been doing anything in a while, I'm kind of concerned about my heart. We'll do a treadmill test just to see where you're at, make sure you're not going to have any bad heart arrhythmias, and then we'll kind of give you a clearance to go start an exercise program as well. So that treadmill study is usually used as a screening mechanism. Good question. Any other questions?
Last screen up again.
Mm-hmm.
I think there was something that I saw.
All right, do something like quick.
Yeah, low blood sugar. I
Mhm.
eat a lot of sugar,
Mm-hmm.
but I don't have diabetes or anything like that.
So if you don't have diabetes, but you're eating a lot of sugars and things of that nature, I mean, I would say good for you. But I would, obviously we're going to promote a healthy lifestyle. We don't want you to eat so many sugars and things of that nature, because even if you don't have it, you can still progress to having diabetes. You can develop diabetes any stage of your life. And obviously, if you don't have it at this point, it may be unlikely that you would have it, but it is something to be aware of.
I know I don't look it, but I'm 83 and a half years old.
Look at that. Look at that. Yeah, amen to that. Congratulations. Mm-hmm.
I'm pretty active. sometimes I get, I call it right in here,
Mm-hmm.
I call it a pull muscle sometimes.
Mm-hmm.
Hurts like the dickens, but it doesn't last.
Mm-hmm. A pulled muscle, is it a pain or is it like a fluttering in the chest or?
It's a pain,
Mm.
and I call it a pull muscle right here,
Mm-hmm.
and it's just right here. It has nothing to do with the heart.
Have you seen your doctor about that?
No, I haven't told him. I have a cardiologist, Dr. Curry, Bob
Good.
Curry.
Yes, at Oshner, yes. I would definitely let him know about that.
I see him once a year.
Right.
I'll see him in November, next month. Bob.
Okay.
Yeah,
Okay.
I'll see him once a year.
All right. I would definitely let him know about that.
I
And
just
is it when you're active? Are you lifting something when you feel it, or it can just be sitting down and you feel it?
just sitting down.
I would go sooner. I would get that
I'll
checked
go
out.
see him next month.
Yes, sir.
No, I'm sorry, not next month, November.
Mm-hmm.
November.
What's the true take on this caffeine and coffee? We had a study just a few months ago saying you can drink all the coffee you want.
Oh, I hadn't seen that study, and I don't believe that study.
1 minute they tell you to drink all the coffee you want, then a month later they say stop drinking coffee.
I saw a study, or I heard a study saying that 1 cup of coffee is fine. Initially, there was like avoid all coffee, but I think I heard something that 1 cup may be fine. It's not mainstream, but I've never heard anything say
They
drink
say,
all the
man,
coffee you
can-
want.
You can drink all the Joe you want. You know, of course I hadn't drunk it in 35 years.
Right.
I'm not about to start again. But
Well, if you want to make my practice get a little thicker there, and you can tell people drink all the coffee they want, because a lot of people have a lot of palpitations then, a lot more. Yes, sir.
I have a pacemaker
Uh-huh.
and it's 2 leads.
Uh-huh.
I'm 90 years old.
Yes, sir.
And I discussed with my doctor to just monitor me.
Mm-hmm.
And I exercise 3 times a week. I have been a vegetarian most of my life. And I just feel wonderful.
Good.
But I want to just go away peacefully. So that's why I just told my doctor to just monitor me.
Mm-hmm. I think that's very appropriate. And that gets into another lecture or talk and things about end-of-life care and how people want to choose their path on the way out the door. He was basically saying he has a pacemaker and he's doing well, and he probably doesn't want all these aggressive treatments at his age. He's 90. And so therefore I agree with that. And that's a discussion you have with your doctor, and you kind of outline that, hey, if something bad happens, I don't want all the tube down my throat, I don't want all the chest compressions, I don't want that. And most doctors will respect that.
not me, him.
So you're 90?
Yeah.
He looks good for 90.
Mm-hmm. Very good. Yes, sir.
Numbness in my thumb. You have any information on that?
A numbness in your thumb.
Yeah, this goes and comes.
So that probably not is dealing with your heart. I mean, sometimes people get what's called carpal tunnel, and sometimes it compresses the nerves in your hand and may have some numbness in some of the thumbs or the fingers. But you definitely want to get that checked. It may be diabetes, and you may be having neuropathy or something of that nature. But I would definitely go to your primary and start the process on getting that checked. Yes, sir. Yes, sir.
30 years ago, I had a mini stroke.
Mm-hmm.
It left my left side numb.
Mm-hmm.
My feet swell sometimes.
Mm-hmm.
Just being laid in bed and it just swells.
Yes, sir.
Goes away.
Mm-hmm. That's
Is that bad?
That's not bad. It can be normal. So his question was, about 30 years ago, he had a little stroke, a mini stroke that mostly affected his left side. And he's saying he has some more swelling on the left side than on the other side, and numbness. And his question was, is that normal? So his answer would be this: in some patients, you have a stroke on one side of the body. The nerves don't kind of work properly. The muscles or the vessels don't contract like they usually should, and therefore you can get more swelling on that one side of the body. So it's not something that's consistent, but it can happen. As long as it's not a significant amount of swelling, I wouldn't worry too much about it. But the swelling may tell you that you've been eating too much sodium, too much salt in your diet, too much fried foods, all these things, and that would tend to lead to you having a little excess fluid.
Thank you.
No problem. Are there any?
How does angina fit into all this?
That's a very good question. So what you asked was, how does angina fit into this grand scheme? Angina, by definition, is you have chest pain, a pressure on your chest, usually caused by blocked arteries. Sometimes people can have palpitations that lead to angina. If you're having a tachyarrhythmia, meaning the heart takes off and goes fast, atrial fibrillation or something of that nature, you may feel palpitations, but then that palpitations may progress into a chest discomfort or pain or pressure. So that's sometimes where people have a difficulty explaining what they're actually feeling, because they may have had a fluttering or, heart flip-flopping, but that flip-flopping progresses into pressure and pain and shortness of breath. And so therefore, angina can be a sequelae of you having these palpitations or some of these irregular heart rhythms. And so that's kind of a good thing to kind of keep in mind, that it may start one way, but it progresses to another thing. You may end up having a heart attack from having some of these irregular heart rhythms, because you may have underlying blocked arteries, and if the heart takes off racing 140, 150, 160 beats a minute, then the blood can't keep up. It can't get through the blocked artery, and therefore you could potentially have a heart attack. So angina is something to be aware of too, that may be a sequelae of having these palpitations. Any other questions? Yes, sir.
My father has a lot of swelling in his legs,
Mm-hmm.
and he's got some thickening in the heart. And how is that related, and what's normally done with something like that?
So the swelling in the legs, generally speaking, if you have swelling, shortness of breath, or fatigue and things like that, he may have what's called congestive heart failure. And now the thickening of the heart muscle, and not knowing your father's whole history, it may be because of high blood pressure. Hypertension can start you to have what we call cardiomegaly or left ventricular hypertrophy. The muscle gets thickened, and as the muscle gets thickened, it gets more stiff and it doesn't pump the blood well, and that can lead to congestive heart failure. And as you explained, it will have you having swelling in your legs. You can be fatigued and have shortness of breath. So it sounds like that's what he may have. Obviously, he'd need to see his doctors and have treatment. I'm pretty sure he's on some medications for that. Yep. Yes, sir.
What is heart failure or congestive heart failure? What is that?
So heart failure, congestive heart failure, same thing. What it is, it can be a number of things. Generally, it's a clinical diagnosis. Again, if you have swelling, if you have shortness of breath, if you have fatigue, most people would label you congestive heart failure. However, we actually look at the ultrasound of your heart and we'd see if there's something abnormal with the heart. Because some people get labeled with congestive heart failure, but they may have a normal heart, and so you have to look for something else. Maybe they have kidney failure, and that's why they're having the swelling and the shortness of breath. They can't get rid of the urine. However, once we look at the heart and see if there's a structural abnormality, either the heart is dilated and not squeezing well, so the heart can get ballooned out. A normal heart should squeeze like this, but if it's ballooned out and it's not barely squeezing, you have what's called systolic congestive heart failure, meaning that it's not contracting. In some people, the heart may contract, but it's so thickened and so restricted, they have what's called diastolic congestive heart failure. So there are two different types, but you'd have to see the cardiologist and get an ultrasound of the heart to kind of see which type you have. But the symptoms are the same: shortness of breath, swelling, fatigue, things of that nature. So
Swelling of the heart?
Swelling of the legs, edema, or sometimes people get swelling in the abdomen. Not everybody puts their fluid ends up in their legs. Some people have abdominal swelling as well.
Can you recover from this or be cured of it?
Not generally cured, it's managed. You take your meds, you stay away from sodium, you exercise, you eat healthy. These things can manage. You can minimize your symptoms, you can stay out of the hospital, but generally speaking, you won't be cured of it. Only way potentially cured if you have a heart transplant, and then you have another set of problems, because then you'd be on the immunosuppressants and all the medicines to prevent the heart transplant from being rejected.
The reason I was asking that, my father, about maybe 8 or 10 years ago, was
Mhm.
diagnosed with heart failure.
Mhm.
And he seemed to be on his last legs. I mean, he passed out in his chair and,
Mhm.
to stand up and pass out this kind of stuff.
Mhm.
And that supposedly there was no real cure for all this, but I think he started taking some diuretics and different things.
Mhm.
I don't remember if this was before or after getting a pacemaker. He's now 91, plays golf once a week, and well, what happened to your heart failure?
Right.
You don't have it
Right.
anymore.
No, he still has it, but he's managing it. He's taking his meds. He's doing what he needs to do. If he stops taking his meds, he'll be back where he was.
Meds would be
The diuretics, he's probably on a beta block. He's probably on
he's on a blood thinner.
he's on blood thinner as well. And he's probably on some type of medicine, ACE inhibitor or ARB. Those have kind of been the mainstay medicines for people with heart failure.
Well, they sure, like I say, he's 91.
Mm-hmm.
Plays golf once a week.
That's awesome. Yes, sir.
I find that with me, it's a state of mind
Mhm.
that I go through.
Mm-hmm.
And ever since these things happened to me, I stuck rigidly to my plan,
Mm-hmm.
and I don't deviate. And as I said, it's a state of mind.
Mm-hmm.
But I hate taking medicine that I know I have to take.
Right. And that's it. You have to take them, especially with the severity of some of the heart disease out there. If you don't take it, it's just only going to get worse.